The hour of 8:30 having arrived, the House Health and Welfare Committee is called to order. First order of business is roll call. We'll ask the secretary to take a silent roll. We do have a quorum present and we are ready for business. Next order of business is announcements. There is an overflow room, East Wing 41, across the hall. So we ask anybody that's standing to move over to that room and observe from that area. Next is tomorrow morning at 9 o'clock committee, we will have a very brief meeting to approve 2 sets of minutes. And that will be our final meeting for the year. Hopefully we will vacate the Capitol sometime on Friday morning. Last announcement is there was a little bit of confusion about the posting of the agenda. The agenda was posted at 6 o'clock last evening. You did have to scroll down to page 2 to see the amended agenda, but it was posted as of 6 o'clock last night. I looked on my computer and it was obviously there. Next order of business is the agenda, and we will get right to that. The first agenda item is RS-24759C2 Healthcare Study Committee, Representative Luker. Representative, if you would state your name and who you represent, sir, the podium is yours.
Thank you, Mr. Chairman, members of the committee. I'm Representative Lynn Luker, representing specifically District 15, the member of this body. We're here to review and introduce a resolution regarding providing care for the GAP population. I should say improving care. Sometimes there's the misunderstanding out there that there's no care, but we do have a network of care for that population through our federally qualified community health centers, rural centers that provide that, plus a backstop of the CAT fund. But that is obviously often inefficient and costly, and so there's a search here for a better path forward. And we have been in discussions about developing a waiver, an Idaho-specific waiver to accept Medicaid funds that have been offered under the Affordable Care Act. As other states have gone down that road, they've found significant fiscal problems, particularly in adopting the traditional Medicaid model. In Idaho, we have an advantage. We've been going down the SHIP program. We've had grants to help us turn to a managed care program. And that has been successful in moving from a fee for service model to a managed care model with better outcomes and less expense. However, that is not completely in place, and it probably won't be in place fully until 2020. And so the intent would be to move this population into that managed care program. And in order to do that, we want to make it an Idaho-specific program. And so the point of this resolution is to convene an interim committee and to work with the Director of Health and Welfare to actually prepare a waiver that's Idaho-specific, that directs, that uses managed care, that it utilizes personal responsibility models that are important to this state, that also shifts the risk from the state to those providing the care, which is the managed care outcome model. And so that is embodied in this resolution to create that interim committee with the direction to also look at the CAT fund and the indigent care model and work towards eliminating those as part of this process. So with that, I would stand for questions.
Thank you, Representative. Are there any questions of Representative Luker or Representative Rushi?
Thank you, Mr. Chairman. I have a couple of questions. Mr. Chairman and Representative Luker, is this bill from you or is it from the GOP caucus?
Representative Luker.
Mr. Chairman, it's a combination of work that I initiated, and there were several drafts of different things floating around, and tried to put a lot of those things in here.
Okay,
Follow up?
now, it's a different area if I could.
Go ahead.
Thank you, Mr. Chairman. So, the proposal is for an interim committee. Was consideration given to the four previous study groups that have been convened by the department or by the governor on this issue, including the fairly detailed proposals that have resulted in prior legislation?
Representative Luker?
Mr. Chairman, Representative Rushi, yes, and as a fact, those prior committees and the work that they've done will probably expedite the work and provide a lot of information that the interim committee will utilize. However, this legislative body has not had its own opportunity to sit down and review all of that, and as a policy-making body, it's important for us to do that in a more specific sense. We've had some minimal representation on those committees, but as a legislative body, this will give us an opportunity to work through that.
One last question, Mr. Chairman.
Okay.
And the Affordable Care Act was passed in 2010. We have had proposals for Medicaid expansion, coverage of the low-income Idahoans who are having health issues, premature death, as well as opportunity to capture some of the financial money. So we've had those proposals since, well, I did one in 2012. And they have not, until this year, received any hearing, and they've never received consideration by this body. And this proposal puts that decision off into the future, and so I can't support it.
No one figured that you would support it, Representative. I would caution everybody, when we leave here on Friday, it's time to go home and campaign. We'll leave the campaigning until then. Thank you. Further questions, Representative Luker?
Mr. Chairman, I object to that statement. That is not a
Your
campaign.
your objection is noted, Representative. Thank you. Is there further questions of Representative Luker? I would remind everyone, this is an RS. There will be no public testimony taken today. Representative Packard.
Thank you, Mr. Chairman. This is a tough situation, has been for a number of years, as has been noted. And it has been a tough discussion, a tough topic for everyone involved. There's so many people that have worked hard on trying to find a variety of solutions, from full Medicaid expansion, with which some truly welcome and are applaud, and others that are just really concerned with that. I am one of those that has been concerned with expanding our existing Medicaid system. For me, I believe it is truly broken, it's inefficient, it doesn't do what we need it to do in many different aspects, in my opinion. That's one of the reasons we have representative government in the US, is there are a variety of opinions. There's a variety of needs, there's a variety of solutions. And I truly want to thank many people that have worked hard on this, from the director, who took our challenge in trying to find a state solution and coming up with an idea that unfortunately didn't get very far down the road. To a certain extent, I guess there's a piece of that even still here, and other community leaders that worked with him, to those of us in the legislature that have worked to bring a variety of ideas forward. It's an emotional discussion, and it has been an emotional discussion, and I think that we hurt ourselves when we dig so far in that we don't try to find a way forward and try to find some progress. I think that's the problem with Washington, D.C., and I hope that we minimize that here in Idaho. I'm sorry.
Representative, be careful.
I will, I'm sorry. Anyway, and so I do want to applaud those that have worked on this, and I do want to thank you, Representative Luker, for taking the ideas of many and improving upon what was here last Thursday. I was very unsupportive of what we had last Thursday, but I think that we have improved this. I do want it noted for the record that I was hopeful that we would maybe make a little bit faster track, but at least we're still moving toward finding the right solution, a waiver here in Idaho that would allow for managed care. It doesn't do it as quickly as I had hoped, but it does move it that way, where the last one didn't. And so I appreciate that. I appreciate you recognizing the needs. And with that, I would like to make a motion that we send RS 24759C, or introduce RS 24759C2, and I'd actually like to recommend that we move it to the second reading calendar.
It's been moved to introduce RS 24759C2 and send it directly to the second reading calendar. Are there any further comments? Representative Redmond.
Thank you, Chairman Witt. I also would like to thank Representative Luker and Van Rod for all the work they've been doing, trying to come up with a solution, and certainly Director Armstrong and his many staff members. What I do like about this is that it's a legislative organized direction, and my understanding, it'll be community-based, which is important, so I appreciate that, and also we still have whatever it comes up with in the next session in 2017 is when we'll make the final decision. Thank you. I will support it.
Thank you. Further comments? Representative Peeler.
Thank you, Mr. Chairman. Maybe just to make a comment. When I first came here to this body, and in particular to this committee, one of the very first things that I was introduced to was those people that fall into the gap. And yeah, this has been kind of an important thing. This is an important step in the right direction. And so I guess the very first thing I ever talked about were cattle, and I'm going to talk one more time about cattle, just for the last time maybe. When I got ready to take over a ranch and purchase it from my parents, I thought, well, my father's run this for a very, very long time, and I think I'm going to ask him for some advice. And so that's what I did. I said, I would like you, I want to ask you, do you have any advice for me going forward? And I was expecting some huge advice, and he did it really quickly. And he said, well, this is what I'm going to tell you. You're going to do a lot of dealings, and the thing that you need to remember, if it's not good for both parties, it'll never end up being a good deal. And I thought, well, that's not very much advice. And then he said, well, do you have any questions? I said, yeah, I do. And so I thought, well, I'm going to get something out of this conversation. So I said, if you're ever pulling a calf and it's a little hard, what do you do? And he said, I just find something that moves, and I move that, and then I find something else that moves, and I move that, and eventually I usually get the calf. And so I think that's where we are right now. I know there's been work done in the past, and I would salute that work. I think it was important to bring us to this point. I think it's important today as we move forward. This is an important issue. It deals directly with real people and their real lives. And we need to make sure that we are committed for the long haul. And this is something, by golly, you got a hold of something that actually did move. And it's a movement in the right direction. And it's going to be fair for everyone in the end. And so I applaud the work, past, present, and in the future that will be done to cover this most important population.
Representative Chu.
Mr. Chair, I'd like to make a substitute motion.
Substitute motions in order.
I'd like to move that we return this to the sponsor. It doesn't cover our needs. We talked about managed care, and House Bill 260 already has us pointed in that direction. And where this bill suggests us go, it really isn't a movement that is a movement that I can see.
We have a substitute motion, which is to return the RS to the sponsor. Is there further discussion? Representative Rushi.
Thank you, Mr. Chairman. I'll make a amended substitute motion
Amended substitute motions in order.
that the RS be introduced and sent to general orders so that it can be modified to meet the needs of the population of Idaho.
It's been moved to an amended substitute motion is to move the RS to general orders. Is there further discussion? Representative Rushi.
Thank you, Mr. Chairman. Without politicking, this is really a question of public policy, and further delay is antithetical to the principles of population health and financial prudence. We're wasting money, and we're exposing Idahoans unnecessarily to premature death. So further delay with another study committee will not save lives, it will not save money, and therefore I think is a wrong decision. We can fix this in general orders.
Thank you, Representative Rushi. Representative Van Weyden.
Thank you, Mr. Chairman, and just support the original motion. I know there's been a lot of discussion, why does the legislature need to look at the waiver? The same reason this committee looked at the first RS and brought it back here improved, because they had different eyes on it. We're coming back with a better RS. That's why I think it's important to move this forward, that the legislature looks at the waiver so that we have eyes on it and improve it, not to kill it, but to improve it. And I think this process works. This is a process we use for all of our bills that come up, even RSs. Sometimes they go to amending order, sometimes, I don't know how many times Representative Luker and I have sat across next to each other and said, no, let's change this language, no, let's change this language. And then once we brought it out, we thought we had it right and we didn't have it right and we changed it again. And I think that's the process of how we get to good legislation, is getting enough eyes on it. So, Mr. Chairman, I would support the original motion.
Further comments? The chair would just like to thank everyone who was involved in this process over the last week or so. For all of those listening and for all of those in the room, and most of you in the room are, at least to some extent, observers of the process here in the Capitol. Success is measured not in the short run, but success is measured in the long run. Success is measured by eventually getting to the point that you need to get to. A lot of us sometimes are disappointed in the speed that we get there, but typically we wind up with a better product. Everybody knew that going to expand Medicaid in the original form of original fee-for-service like we've had in the state of Idaho was never going to go anywhere. We were only going to get to Medicaid expansion when we had a system that we can measure outcomes, we can control costs, etc. Apparently, most of Medicaid will get to a managed care model in 2020. It's probably not appropriate to get much ahead of that curve with respect to the financial obligations, etc., of the state. So while there are probably many disappointed people with the speed at which the legislature appears to be moving on this topic, we've had many references to many animals and how you can, whatever, I won't use another one. But the fact is that we do what we can do, and you can't get done what you can't get done. So, Representative Rushi.
Mr. Chairman, I think delay, and I've said it, I think delay is unreasonable. I also note that in the bill, it talks not just about the interim committee and working on a waiver. And by the way, I put together a plan with CMS in my prior life at Regions, and committees don't negotiate with CMS. So I really don't understand how that works at all. But the thing that bothers me is on line 27, 28 on the second page. Not that we'll have it done within a year, but we may request for reauthorization. Request for reauthorization. How long, good committee, how long are we gonna drag this out?
Thank you, Representative. Any further debate? We have 3 motions on the table. There's not room for another motion. So we'll take up the amended substitute motion first, which is to move it to general orders. All those in favor? We'll ask the secretary to take a roll call on the amended substitute motion.
Chairman Wood,
No.
Vice Chairman Packer. No. Representative Hickson.
No.
Representative Perry. No. Representative Romrell. No. Representative Vanderwater.
No.
Representative Beeler.
No.
Representative Redmond.
No.
Representative Troy. No. Representative Rushi.
Yes.
Representative Chu.
Yes.
Motion fails on a 9-2 vote. We'll next take up the amended motion, which is to hold in committee. Do you wish a roll call vote or no? Take a roll call vote.
Chairman Wood,
No.
Vice Chairman Packer. No. Representative Hickson.
Yes.
Representative Perry. No. Representative Romrell.
No.
Representative Vanderwater.
No.
Representative Beeler.
No.
Representative Redmond.
No.
Representative Troy. No. Representative Rushi.
Yes.
Representative Chu.
Yes.
Motion fails on an 8-3 vote. The original motion, which is to introduce and send to the second reading calendar. All those in favor of the original motion?
Mr. Chairman, if I could speak to the motion.
Sure.
The motion calls for this to be sent directly to the second reading calendar. We have never had testimony, we have never had debate on this or a similar motion. They did have a truncated testimony on Senate Bill 1205. However, we have never, since Tom Lurcher presented his Medicaid expansion bill back in 2013, had a discussion on this. And I think it is improper to move this forward. We think we know what's right, but wouldn't it be wise to hear what the people of Idaho would like? Mr. Chairman, that's why I'm going to be opposing this.
We've had many discussions about this, and we've had many discussions with the citizens of Idaho. I understand they're not here to actually testify today. But we are moving, we are making progress, we are getting to the end of the session, and we will vote on the motion. Representative Packer.
If I could just speak to that a little bit, because I do understand the concern with that, and I debated on that for a while. My concern is going home with nothing, and that's really our alternative. I'd rather see us at least get this much movement out of it than to go home without anything. Thank you.
Representative Hickson.
Thank you, Mr. Chairman, and just to explain my no vote, I'll be a no vote on this as well as the next RS, and I'll explain a little bit more at that point in time. But I don't think that putting a committee together to study this over the interim is going to accomplish what I think it's going to accomplish, or what Idaho needs it to accomplish. It seems to me like the studies have been done. I think we're just down to the grassroots issue of whether we want to do something with Medicaid expansion or not. And for that reason, I'll be voting no, Mr. Chairman.
Thank you. Representative Rushi.
Thank you, Mr. Chairman, and I understand the good lady's desire to do something, but I submit that this does nothing.
Thank you. Any further comments on the motion? All those in favor of the original motion say aye.
Aye.
Roll call vote is requested, please.
Chairman Wood,
Aye.
Vice Chairman Packer,
Yes.
Representative Hickson,
No.
Representative Perry, Representative Romrell,
Yes.
Representative Vanderwada,
Yes.
Representative Beeler,
Yes.
Representative Redmond,
Yes.
Representative Troy,
Yes.
Representative Rushi,
No.
Representative Chu,
No.
Motion passes 8-3. The RS will be introduced and sent to the second reading calendar. Next agenda item is RS 24790C760C3 Healthcare Grant Program. Representative Luker.
Thank you, Mr. Chairman, members of the committee. This RS is designed to do two things. One is to collect some additional information about the GAP population as we move towards managed care. Health and welfare has certain information regarding demographics, but not specifically regarding their medical conditions, whereas the federally qualified health centers and rural health centers are able to collect that information because they see this population. The second part is to provide some additional funding. One of the disadvantages of the current program is that while those clinics do see the GAP population, they don't have a organized way or means of actually doing follow-up and creating a medical home. It's a fee-for-service model that we're trying to get passed. And so this grant, there's two parts. One would be a $400,000 study done by the federally qualified health clinics to collect more information about the population and their medical condition. That would come out of the general fund, and there's a $5 million grant that would go to that group and rural health clinics to actually deliver services. Some will say, well, that's not enough, but again, it's a start, and it's a place that we have money available. The $5 million would come from the Low Income Fund, from money that will be available, and the $400,000 would come from the general fund. So with that, I would stand for questions.
Thank you. Are there any questions, Representative Luker, Representative Rushi?
Thank you, Mr. Chairman and Representative. So does this make an appropriation from the Millennium Fund?
Representative Luker?
Yeah, thank you, Mr.
You want me
Chairman.
to comment on that? or-
Well, I can take a stab at it, and then you can. Mr. Chairman, Representative Rushi, it does not specifically. There would be a third appropriation bill that covers those specifics. There,
Mr. Chairman,
Follow up?
thank you, Mr. Chairman and Representative. So this is, to my mind, the first time that we have bypassed the Millennium Fund Board in evaluating potential uses of Millennium Fund money. Is that the intent of the legislation?
Representative, that's not what's going to happen. We're going to use the same mechanism we used when the economy went down and we spent the corpus of the Millennium Fund without consulting the Millennium Fund Committee. And what this does, the $5 million diverts the $5 million from the master tobacco settlement that would go to the Millennium Fund. It diverts it into the income fund to be appropriated by JFAC directly. So it doesn't affect the amount of money next year that the Millennium Income Fund is going to have to disperse to the various projects. All it does is to take the annual corpus or annual revenue that would go into the Millennium Corpus for 2 years and divert it to this program. Do you understand that?
Yeah, I think I do. I think, Mr. Chairman, this is not similar to the bill that was not printed earlier this year.
A portion of it was, which is the direct, which is just bypassing the Millennium Fund with $5 million going to the income fund, going directly to the income fund. Further questions of Representative Luker? Representative Troy?
Oh, yeah, it works. Mr. Chairman, I move to send RS 24760C3 to the floor for a second reading, to the second reading calendar. And if I might speak to my motion.
You bet, go ahead.
I think what has been so powerful this year and last year is the faces that are part of these folks in the GAP population. And each one of them has a story, and many of them came and shared their story with me in my office or over the phone or by email, and I so appreciate that. This maybe wasn't the direction that we all wanted to go, and I appreciate all the work that's come before. My kids know that there's seldom a back road that I drive by that I don't want to take, and I was visiting with a gal last night about how long it takes to get from Warm Lake to Twin Falls over the Forest Service roads. And this maybe wasn't the road we wanted to take, but it's gonna take us longer to get there, but it's still, I'm confident, going to get us to where we want to go. And I feel that this grant is an effort to do something to help take care of folks while we're getting there. And I'm especially pleased that we've added the rural clinics to the other clinics in order to make sure we're covering the entire state of Idaho, because those backcountry roads go by those clinics. So thank you so much.
Representative Redmond.
Thank you, Chairman Litt. I'll be supporting the motion. I'm glad that we're finally moving forward with helping out the community health clinics who've been doing a great job, particularly Heritage Health up in my neck of the woods. And I think this will continue to advance towards a medical home, patient-centered medical home, and that's what I'm looking forward to getting accomplished and helping the 100% below poverty level.
Thank you, Representative Rushi.
Thank you, Mr. Chairman. And I would like to say that grants to the community clinics and their own rural clinics is a good thing. But that's what this is. This is a grant to help them in their operations. We had testimony before us from Terry Riley Clinics that they're already patient-centered medical home for their patients. And they currently see 85% of the estimated number of GAP patients in their catchment area. So they're already doing this. Now, will they be able to have better cash flow? No doubt. So in that way, it's probably a good thing. I have problems with directing it from the Millennium Fund without further discussion of that, but again, we're not going to have testimony, we're not going to have hearing, we're just going to send it. I don't think that anyone should be deceiving themselves to think that we're really doing something about health care for low income. This is a grant for the community clinics. Will help them in their cash flow, will help them do additional activities, but it will not provide coverage for the GAP group. And as far as needing data, I spent 11 to 12 years in the health insurance industry. I know how to build a premium. We have plenty of data to be able to tell how much care in this population is going to cost, and whichever model we use, fee-for-service or a managed care model. 31 states have already developed products for this population, and in my experience and my understanding is we can do that now. We can tell you how much it's going to cost. What we can't do it though, we can't do it without authorization to develop a product. And that's the thing that both of these actions today miss, is we miss the instructions to develop a coverage product. And I think that's a shame.
Thank you. Further comments? Representative Chu.
Mr. Chairman, my voice struggles to speak because my mind is really struggling with what we've got before us today, because it seems to me that the last time we met, we were talking about reconsidering everything and moving forward to something that would actually do something. And I think in this very room, I heard the words of my colleagues, and that was that we didn't want to throw money at a study that we didn't need. And we didn't want to go home and do nothing. The thing is that when we give a grant to our clinics, our rural clinics included, that is a good thing in some ways, but really, I've heard it said that it's a lose-lose, and I always work for a win-win. When we give them a small amount of money to help them take care of our 78,000 people, it comes with a high expectation that they be successful. It's not enough money to be able to care for these folks, and yet they'll be responsible for doing that. We have that expectation. So, they've, in essence, been given something that will be a harder cross to bear, really. And I'm really sad for today. I would have liked to have seen us to move something forward, to go home with something. And I'm not going to stop moving us that way if we can. I want that discussion. I think it can be done here. I wish we could do something at a general orders and fix this. Last year, we came back for a special session to fix something, and I'm going to be talking about that, because this is something we can fix. Thank you.
Thank you. Representative Hickson.
Thank you, Mr. Chairman. Let me just say a couple words here about this motion and kind of where I'm at in this whole process. First and foremost, let me say that I have the utmost appreciation for those that have worked on this issue and tried to bring forward a solution. My heart goes out to those that are in the GAP population, no doubt about it. I have met with them and listened intently to their struggles and their stories. It's an everyday struggle that you are in, and I have a unique understanding of this because of how I grew up. I also understand, however, that the struggle that the middle-class taxpayer in Idaho is faced with year over year, and that struggle is also real. The burden on the middle class right now, as we speak, is getting worse every year with double-digit increases in insurance premiums, along with higher deductibles and co-pays. This is not an easy decision for me, and I have toiled with it for many nights. For those of you that have followed my service at the state capitol, you have seen the effort I have put forth in trying to put more buying power back in the hands of the everyday Idahoan. I wholeheartedly agree with the status quo in healthcare.
Mr. Chairman, is that some campaigning that's going on here? If it is, I really have to object.
I think the gentleman is trying to explain his philosophy about why he's going to vote the way he's going to vote here. So, but do be careful, gentlemen. Again, I would caution everybody, okay? Come Friday, we can go do those kinds of things, but go ahead.
Mr. Chairman,
be careful.
No problem, just a quick comment, I'm not trying to do that. Representative Chu, thank you. Let me get back to what I was saying. It's not an easy decision for me. I have told this night over night. I wholeheartedly agree that the status quo in healthcare needs to change, and I am committed to furthering that effort as their state representative. With the managed care, the SHIP initiative, and more buying power as it relates to healthcare for Idaho citizens. What I will not do, however, is vote to approve another government program that expends more taxpayer money in place of a viable solution. The best path forward in my mind is a healthcare system where patients have more buying power and the insurers and providers are engaged in a healthy competition. The state of Idaho already provides a tremendous amount of tax incentives to our providers specifically for the purpose of taking care of the medically underserved. We also have the CAP Fund and agent programs that are doing their jobs in Idaho for this population.
Mr. Chairman, I'm gonna say that he's campaigning,
Right.
and,
Good gentleman, I think.
and I believe we have asked to not do that in this committee, and I would ask that that be shut down.
Okay. Wrap up pretty quickly and
Okay.
without philosophy.
Sure. Thank you, Mr. Chairman. I apologize to the committee. It's not what I'm trying to do, but I will wrap it up. My point here is that we see healthcare costs and insurance premiums rising faster than what the average Idahoan can keep up with. We need to come up with a viable solution. What I see before me today is not a viable solution, and for these reasons, Mr. Chairman and committee, I will be voting no on the proposal. Thank you.
Thank you. Further comments?
Mr. Chair, I do have,
Representative Chu?
I do have a comment, and, you know, the good gentleman's comments really bring forth something that really helps me be able to articulate my struggle here, because we talk about less government. What we're looking at, that I thought we'd be seeing today, would have been less government. When we look at catastrophic fund and indigent stuff, that's the stuff that needs to go away. That's the kind of government stuff we don't need. We want something that works and works for the people. That's why I'm gonna be voting no on this. Thank you.
Further comments? The chair would just like to thank everyone involved in this process in the last week or so. Well, the process of the whole session, for that matter. It has come to a head in the last week, but there were efforts ongoing all session long. Most behind the scenes, but there were efforts going most every day. And I want to thank everybody. I want to thank everybody for coming to some kind of a solution. And it may be the best we can get, because I don't know that anybody's happy. And so you either have to have everybody happy or everybody sad or mad, or whatever combination of that you're going to have. But anyway, I personally want to thank all of the committee members for your good work. This session, we will have a brief meeting tomorrow that we can talk a little bit about the minutes, et cetera. So, any further motions? Hearing none, all those in favor of the original motion say aye. Roll call vote. We'll take a roll call vote when the secretary is ready on the original motion.
Chairman Wood,
Aye.
Vice Chairman Packer,
Yes.
Representative Hickson,
No.
Representative Perry, Representative Romrell, Representative Vandewalle,
Aye.
Representative Beeler,
Aye.
Representative Redmond,
Yes.
Representative Troy,
Yes.
Representative Rushi,
No.
Representative Chu.
No.
The motion passes on an 8-3 vote, and RS 24760C3 will be introduced and sent directly to the second reading calendar committee. Unless there is something more that needs to come before the committee, we'll stand adjourned until 9 o'clock tomorrow morning.